welcome to this special episode of So That Reminds Me, Reminder Publishing's bi-weekly podcast on Western Mass News. This week's edition, which is, of course, a special one in between our regular scheduled programming, is with Kimberly Lee from MiraVista Behavioral Health Center. And we're excited to have her join us. And it was really a very enlightening discussion. So I'm glad that we were able to have that conversation because I think that it's important to have those mental health discussions. But before we get into that, I am here, Chris Maza, with Tyler Garnett.
Yep. How's it going, guys?
And first, how are you doing, Tyler? I mean, we've had some softball, we've had some ice cream.
Yeah.
Summer is kicking into full gear.
Yeah, summer is in full swing. I mean, as of recording today on Wednesday, I know it's sunny and 80 outside. I wish we could record this podcast outside, willing. But yeah, everything is going good so far. Just, hoping it stays nice on the weekend for once.
No kidding. It seems like every Saturday it's just like, well, it's going to rain now.
Yeah, I think I saw something that since either February or March, every single weekend in at least Connecticut has had a chance of rain for the last 3 months.
I believe it.
Yeah, and, that's, I guess, New England weather. And I know I keep saying it, but I won't be complaining about the rain when July comes and it's 100 degrees, I'm sure. So,
well, I gotta say, I am looking forward to the summer. We're getting close. My wife's a teacher, and I've got a 7-year-old daughter, so they're getting ready for summer vacation. And so it's really it's an exciting time with a lot of things going on. As much as I love being here, I'm looking forward to getting out and experiencing a little bit of summer this year.
Of course, and I know we had our great episode last week, which if you haven't listened to, please do on the website or on YouTube or any other podcast platform you like. But we talked about ice cream, which is obviously perfect for this time of the year. And, it's made me been thinking about ice cream ever since the episode and wanting to try more places. And, I know we had one person reach out to us via email, right?
That's right. They did. On top of, we got a couple of comments on social media about it, which were also well received, and we're glad to have those. Somebody actually took the time to write an email, so
that's awesome.
Thank you to Amy DePrati, who actually had a suggestion for us on another place to try, as if we don't have enough to, I feel like we talked about the magical mystery tour of ice cream that we could go on. She suggested Granny's Place Farm, which is in Agawam. She called it Agawam's sweetest hidden gem. So I'm not going to go through the entire email, but basically she said, if readers are looking for an authentic, community-rooted, and totally delicious local outing, I can't recommend Granny's Place Farm enough. It's a true treasure of Agawam, and I hope more people get the chance to discover it. So we can add that to our list. And Thank you very much, Amy, for reaching out. Of course, if anybody else has any comments or suggestions, on this or on anything that we talk about, we are obviously very happy to hear from the community. And we're very grateful that people are listening and reaching out and really connecting with us on these conversations we're having.
Yeah, I think that's important to know that we're not just talking into a mic for no reason. It's good to know people are listening. And, I know you didn't read the whole email, but you sent it to us. And through reading it, I hope she earns commission off that because it was definitely really highlighted how great this place is. And it is definitely one of my next stops next time I'm around the Agawam area.
Well, one thing that I did chuckle at with this is they make their own ice cream on site using what they affectionately call the hit or miss machine.
Yep.
But yeah, so I appreciate the suggestion on the place to eat more ice cream. I'm always down for that, and I appreciate you reaching out and being part of the conversation. So that's great. I would love to have more of that from our listenership.
Yeah, I think so too. And I know we've talked about in the future, we'll kind of keep our eyes on the dates coming up, whether it be in the future, say a National Margarita Day or a National, we did Food on a Stick. Make sure to keep an eye on our social medias, because we'll say a week or two ahead of time saying we want to try this specific day coming up. And, we would love to hear you guys' suggestions before we do the next national food or drink on a specific day.
All right. Well, we are now going to get into our main topic, our conversation with Kimberly Lee. But before we do that, we are going to pause for a brief message.
We get it. You're busy, but you want to be connected to your local community. If you're not reading The Reminder, Western Mass's free weekly newspaper, you're missing out on the heartbeat of your town. Stay in the loop with all the latest buzz, from local stories to community updates and exciting events. It's all in The Reminder. Just log on to thereminder.com and dive into the hometown news you love. To subscribe to receive The Reminder at your home, call 413-788-1316. Don't miss a beat. Your town, your stories, your community for over 60 years. The Reminder. We are hometown news.
Summer's heating up in Western Mass, and the next issue of Prime is your ultimate guide. From concerts and festivals to car shows and getaways, we've got everything from the 4th of July to the Big E covered. Our RV expert shares free camping tips. AAA helps you plan that next big family trip. And our travel writer sets sail with Holland America. Oh, and the photo contest? It's back! And if you're an advertiser looking to help people add a little sizzle to their summer, contact sales manager Scott Green at 525-6695.
Well, today we are welcoming in Kimberly Lee from MiraVista Behavioral Health Center in Holyoke. Welcome.
Thank you both so much. Thank you. So happy to be here.
Well, first off, can you tell us a little bit about MiraVista and your mission and what services you provide?
Sure, absolutely. So MiraVista is a large standalone psychiatric hospital located in Holyoke. We are what once was Providence Behavioral Health, and several years ago, the Trinity Health System made the decision to sell that building, which meant that the inpatient beds as well as the outpatient substance use treatment would have been gone from the Western Mass landscape for individuals who live here and who would have needed those services. So once the state heard of their decision to close Providence, they, being the state, reached out to our ownership group. We actually have another facility, another hospital located in Devens, Massachusetts, which is MiraVista. And the owners of that facility said, absolutely, we will purchase that building. We will keep those beds and those outpatient substance use treatment programs online for this community, for this section of Massachusetts. And so they did. And so in 2021, we reopened as MiraVista Behavioral Health Center. And so fast forward 4 years, we have grown exponentially. So we offer 16 inpatient beds for adolescents who are between the ages of 13 to 17. If they're 18 and they're still attending high school, they will be admitted onto the adolescent unit. But if they're 18 and older, they'll be admitted onto our adult unit. So all in all, MiraVista provides 88 beds for inpatient psychiatric treatment. So 16 of those beds are for adolescents, and 72 of those beds are for adults. So that's a total of 88. And then in addition to our inpatient treatment for mental health, we actually have a whole host of outpatient substance use programming as well. So we have a very large opioid treatment program at MiraVista. We are dosing methadone. We are also dosing Suboxone, Vivitrol, Sublocade, and Brixadi for other substances. We have one-on-one outpatient substance use counseling. And then we have a wonderful program which is called an intensive outpatient program. Why it's called an intensive outpatient program, I don't know, because it's not intensive. It's actually a lovely program that runs between Monday and Friday. So individuals attend at least 3 days a week. There are 2 different tracks. If they're a morning person, they can come in the morning. If they would prefer to leisurely, roll into their day, they can come in the afternoon. And it's an opportunity for individuals to work together as a group, a facilitated group with a master's level social worker, about their addiction. And so understanding the disease of addiction. We also have music therapy. We have art therapy. We have comfort dogs that come in. But it really is, it is so interesting to watch, because my office is right near the front lobby. And you can always tell when somebody's new to the IOP because they're a little unsure. It reminds me of what my first day at elementary school might have looked like. You're not sure who's going to sit next to me. Will I make new friends? And so the first day people come in, they're really not sure where they're going, and then by the third day they're going to, grab a coffee together. They've exchanged Instagrams, because it's really important for individuals who are in recovery to now have a new sense of community and to build those relationships with other individuals who are in recovery. A good friend of mine, a recovery support navigator, once said to me, iron sharpens iron. And so the sense of community, the connections that people are making at MiraVista in our outpatient substance use programs are really life-changing. So MiraVista, a very long answer to your very short question. We are located in Holyoke. We are serving all of New England. We have patients from all of the 5 and 6 states that comprise New England. We take all major insurances, including Mass Health. And just an important note, we actually provide transportation to and from our outpatient substance use programming. So we know transportation can often be a barrier for individuals who need assistance with substance use treatment. So just a note that we do provide transportation.
Yeah, no, that's definitely important. And you mentioned a lot of the programs you have offered since 2021, and you've grown and evolved. And I was just wondering if you could touch just a little bit more on that. Is that because of trends you and the organization were kind of seeing in Western Massachusetts, or was it a more proactive kind of decision?
It was a little bit of both. So, one thing that I do feel very proud in terms of MiraVista and the culture and our leadership in terms of, being strategic, is that they are very good at identifying community need as well as anticipating community need. So it's a little bit of both, definitely responding to the greater need that exists for individuals in our part of New England and or the Commonwealth to have access to convenient inpatient psychiatric care and outpatient substance use. And it's also, in reaction to wanting to identify or have individuals identify MiraVista as an organization that can serve that dual diagnosis, which is both mental health as well as substance use.
Now, does MiraVista collaborate with other local organizations and healthcare providers?
Very much so. Great question, Chris. We really do. It's it's often said that rising tide floats every boat, right? So we do understand the importance of collaboration and partnership. So referrals that come into MiraVista are coming from health and human service agencies. They're coming from emergency departments. They're coming from physicians' offices, pediatricians' offices. They're coming from individuals themselves as part of our new direct admission process, which I'd love to talk a little bit more about later in the interview if we could.
Sure.
So referrals are really coming from very strong community partners, stakeholders, organizations that we have very strong relationships with, including the community behavioral health centers, or the CBHCs as they're referred to. And these are the new statewide facilities where individuals can walk in 24 hours a day, 7 days a week if they're feeling that they're in crisis. And so we work very closely with their clinicians who identify individuals who would be appropriate for an inpatient level of care. And then we also, in terms of discharging patients, we also, have to and want to maintain strong relationships with those individual agencies or entities that can then take our patients as part of a continuum of care. So working with other substance use programs or working with other nonprofit organizations where when our patients leave us, they can have future helpful, supportive services and programs.
Definitely. And, I know we're recording this in June, but May was Mental Health Awareness Month. And I was wondering if MiraVista
Yes.
conducted any special programming last month.
We, in terms of special programming, what we did, we talked a lot internally, with our staff, because even though externally we talked a lot about, May being Mental Health Awareness Month, part of Mental Health Awareness Month is also self-care and making sure that individuals are aware of how they're feeling emotionally. So we spent, some time, actually a lot of time during that month, talking with staff and engaging with our staff on and around the concept of self-care. And then for the month, we actually teamed up with the city of East Hampton, and we held a public flag raising, which was great.
So one of the big things is, and you see this a lot with, regardless of what time of year it is, during Christmas time, you'll see toy drives, and during Thanksgiving time, you see food drives. But with everything, it's like, okay, we've got to focus on this now. And obviously, May being Mental Health Awareness Month, there's a focus on that. But how do you keep the momentum going and keep those conversations going throughout the year? Because it is a need that knows no bounds and no limitations.
You're right. Exactly, and absolutely right, Chris. And point is very well taken, because while Mental Health Awareness Month gives us an opportunity for heightened awareness about how we are all feeling emotionally, it's a conversation that should be had every day of the year, every month of the year, because mental health is indeed health, right? So how we're feeling physically is often motivated and influenced by how we're feeling emotionally. I think back to those times in high school where it was test time, or, I was getting ready to present a paper. Those butterflies would get going, suddenly my tummy would be upset, my head would hurt. And that was because of anxiety. That was because of, the test anxiety that I was experiencing, or the presentation that I was worrying about. So the connection between our mental health and our physical health are really so tightly connected. So the opportunity to talk about mental health, every day of the year and consistently is so important. People should feel just as comfortable and as confident talking about their mental health as they do their physical health. When you think about it, none of us have, any issues with telling each other, when our stomach's upset, or when our back is hurt, or, oh my gosh, my knee is bothering, or, this darn arthritis. But when it comes to our mental health, we really don't have those outward conversations that allow us to talk openly and transparent about, gee, Chris, today I'm feeling a little low, or, Tyler, today I'm a little anxious because, I have this going on in my life. So I think the more we can talk about it, the more it will erase that stigma that so many people still feel when talking about their mental health.
And we'll be back after a few short messages.
Every month, Reminder Publishing's Go Local magazine features the best Western Mass and Northern Connecticut businesses. With articles on new storefronts, coffee shops, restaurants, and more, Go Local magazine is your resource to find the best businesses to frequent in the area. Go Local also features original recipes, how-to pages on festive crafts, a listing of places to go, and experiences to enjoy over the course of the month, and so much more. Pick up Go Local magazine at hundreds of businesses, banks, gas stations, and restaurants all over Western Mass and Northern Connecticut, or check out Go Local Magazine at thereminder.com.
Looking to age well and live smart? Savvy After 55 is your guide. From fitness and nutrition to staying social and engaged, Savvy has the tips to help you thrive. It's also your go-to guide for caregiving, veteran services, job training, advocacy, and more. Savvy After 55, because that's what you are, and we're here to help. And are you an advertiser who wants to reach our Savvy readers? Contact sales manager Scott Green at 525-6695.
Now looking at June is Men's Health Awareness Month. So I was wondering if you could talk about some of the unique challenges that men face when it comes to mental health.
That's a great question. And actually just was working on a press release for the week before coming here. And I think, the men in our lives, men from an early age, are really somewhat conditioned to be that rock, right? To be that sense of support, that individual who will help care for the family or who will, be that sense of strength and will have to at all times appear to be strong. When in all actuality, openly talking about how men feel about their mental health, and not just to a clinician or, to a psychiatrist or to a medical professional, but again, to each other. You go out for a cup of coffee or you're on the golf course. It's okay to talk about how you're feeling. And in fact, it's really important to get that out and to have that conversation. And there's no weakness in that. Mm-hmm. In fact, if anything, it really is a sign of strength.
Mm-hmm.
Yeah, I think that one of the big things, and you touched on this a little bit, is, there is a stigma attached to the mental health conversation overall, but it seems that there's a very specific one when it comes to men and their mental health. And how does that impact their willingness to seek help?
It can. It can. Again, it's and certainly because it's Men's Health Week. But I think to every gender, mm-hmm. there are at times, a lot of times, when individuals will, and not understanding, and it's important to note, so I'm not a clinician. Mm-hmm. I've just been in this industry for a very long time.
Sure.
And it's interesting because if you have an illness or a disease such as, maybe it's high blood pressure or cholesterol or diabetes, those are very easily recognizable and to talk about, I should say. When you're diabetic or you have hypertension, you go to the doctor, you receive medicine, you adjust your diet, you exercise, and that's an open and free flowing conversation. But when you have anxiety or depression, or maybe it's, schizophrenia or bipolar, having that awareness that it is something in your brain that is not functioning mm-hmm. correctly mm-hmm. and just needs to be adjusted. And that can happen through talk therapy. That can happen, I know in my own situation, anxiety will at times want to get the best of me. I go out for a run, mm-hmm. or I'll talk with my husband or my children or a colleague about it. I might understand in that moment, well, I've had a lot of coffee and now I'm experiencing a high degree of anxiety. Maybe I should switch to decaf.
Mm-hmm. So
it's just being much more aware that it is a diagnosable illness. Mm-hmm. And with a diagnosable illness, there is treatment.
Yeah, no, of course. And, I know you just mentioned a couple different ways to help ease anxiety, whether it's talk therapy or going on a run or even just some physical exercise and stuff. And obviously you mentioned at the top of the podcast, different programs for adults, adolescents that MiraVista provides. But I was just wondering, are there any programs specifically geared towards supporting men at MiraVista?
Not necessarily specifically for men, but all of our treatments are really geared towards the individual or that specific patient.
Perfect, yeah.
So it really isn't a cookie cutter approach. You know, what might work for you, Chris, might not work for you, Tyler, and what works for me might not work for either of you.
Of course.
And so our clinical team, our providers, are top notch. They have so much experience and are so well educated in the field of mental health that they approach each and every patient as an individual. And every individual's history will influence where they are in terms of their own mental health. And so it's really important that each one is approached distinctly and not with a cookie cutter treatment.
I think that's a great point, that even in the subsets of our population, of our society, you can't necessarily put everyone in the same box. Everybody has their own unique needs.
Definitely.
That's right. Definitely. Absolutely.
So we're obviously in June. Schools are getting out. We're starting to get into summer. And a lot of times kids who are in school are able to get some supports and things like that. But as we get into those summer months, adolescent mental health especially can be somewhat of an overlooked need. So how can we keep that issue in mind through these summer months?
Absolutely, Chris. You know, we at excuse me, at MiraVista talk a lot about, you know, adolescent mental health doesn't take a summer vacation. And you're absolutely right. In school, young people have a sense of routine. They have consistency. They know that they're going to see their friends. They know they're going to have English at 10 o'clock. They know their teachers. They are really surrounded by a caring community of individuals who can support them and their mental health. And then suddenly, here comes June, and school actually is out next week, I think the end of the week, June 17th for some districts. And suddenly, that consistency is gone. You know, that sense of structure and routine is gone. And teenagers, adolescents who really relied on those clubs or their sense of community, whether that was a Dungeons and Dragons club, or it was Above the Influence at Minnetonka, or it was band, or it was track and field, whatever it might be. You know, suddenly that sense of community might not be at the same level or the same strength that it was during the school. And so it's very important now for trusted adult caregivers, even our community at large, to just be aware of the young people in our lives and how they're feeling, and to ask them how they're feeling. You know, to ask them. I remember my husband and I, when our children were younger, our girls are now 25 and 23, but even now we still ask them at least once a week. We'll get on a FaceTime, you know, call, but when they were young, we would, you know, bring them into the living room. We would all, you know, hang up and hang out our, you know, we'd hang up our phones and just hang out. And we would ask them, how are you? You know, how are you feeling emotionally? What's happening? Let's have a conversation. And just those 3 words, that question, how are you, elicited such great responses from them that they were waiting to talk about or wanting to talk about, but it might not have been the appropriate time. So just sitting down with the young people in your life and just asking them, how are they, to let them know that there's a reassuring, you know, person, or there's help and there's support should they need it. And there is somebody who they can turn to be open about how they're feeling without, you know, fear of stigma. You know, that people will think, well, you know, just you'll get over it, or, you know, move on, it's just a phase, but really taking the time to understand how they're feeling emotionally and to just ask them, how are you?
Yeah, I think that's really important. I know you gave us this flyer, and I really like on top, adolescent mental health doesn't take a vacation. And it's really a great point, because it's something I know I didn't even think about. I mean, I know I'm older and out of school now, but even just going on vacation, a couple of days could be stressful of travel. Maybe you're used to having breakfast, lunch, and dinner, but breakfast was closed, you missed it, so now it's just lunch and dinner. So things like that, and now it's, instead of going to school, 2-3 months of summer vacation could really change everything.
It can. It can be a disruption in structure. It can be a disruption in routine, and it can be a disruption in that sense, that very real sense of community that kids feel. Mm-hmm. It's we used to say to our girls, friendships and a sense of connectivity. It's not about a quantity of friends. Mm-hmm. It really is about quality. So, to have 1 or 2 friends versus feeling that you have to have, 10 or 15 friends. Of course, yeah. It's just really having somebody in your life who you mm-hmm. have a connection with and who you feel comfortable talking with.
Of course, and it says that MiraVista remains fully operational for adolescents still attending high school who need behavioral health. So
we do. Mm-hmm. In fact, we have another little saying at MiraVista, and that's that when school's out, MiraVista is all in. So nice. we are actually very fully operational mm-hmm. Throughout the summer and all school vacations. So pediatricians, primary care physicians. Mm-hmm. Other health and human service agencies who, the Boys and Girls Clubs or the YMCAs. Mm-hmm. Those are all places where young people will now turn for the summer for activities. Mm-hmm. And so we encourage individuals who are seeing young people who may be in need of our services to absolutely reach out.
That's great.
Now, you had mentioned something that you wanted to talk about earlier. Was it the direct admissions?
Yes. Thank you, Chris. So early on, when the Executive Office of Health and Human Services for the state of Massachusetts unveiled what it termed its behavioral health roadmap, it talked a lot about emergency room diversion and trying to keep individuals out of the emergency department when a trip to the ED really wasn't necessary to access inpatient mental health. And that's accurate. Individuals who are seeking inpatient treatment from a facility like MiraVista don't need to first go to the emergency department. We now have a process which we call direct admissions. Mm-hmm. So let's say you are a parent and you have a 15-year-old who is clearly in crisis. You can call MiraVista directly, and we can walk you through the process of
awesome.
Getting an assessment from a clinician, and that could be from an organization like Clinical and Support Options, or perhaps the Center for Human Development, or the Behavioral Health Network. But those clinicians will provide MiraVista with an assessment which documents inpatient level of care as appropriate. Mm-hmm. We'll help to navigate that process with parents or individuals themselves or other family members who have a loved one who needs to come in inpatient. Mm-hmm. And they'll drive them in. They'll drive themselves in. Mm-hmm. They'll have friends or family drive them in. But individuals in that moment have, averted a lengthy emergency room experience. They've avoided a costly emergency room experience, mm-hmm. and they've also avoided EMS costs. So direct admissions is a much kinder, quicker way mm-hmm. to access inpatient behavioral health treatment.
Yeah, that sounds great. I mean, I know just even picking up the phone sometimes to make the call is anxiety inducing already. So, it seems like you definitely help with the process, which is great.
We do, in fact, and we get calls, we get emails every single day from individuals who, I don't know what it is I don't know what it is mm-hmm. I need. I know I need something, and I'd like to talk with an admissions staff member about how I'm feeling. Mm-hmm. And we talk with them. We get a callback number. We first and foremost make sure that they're in a safe space mm-hmm. because the emergency department is absolutely where an individual should go if they are feeling in an extreme sense of self-harm.
Mm-hmm.
So for individuals who are not in a safe space, the emergency department, by all means, would be their first option. However, if the individual is safe and they're with loved ones or family or friends, they can call MiraVista, they can come through the front door, and we can guide them, help them navigate the process for an inpatient admission.
That's great.
I think that that's an interesting point that you just made. Is I think sometimes people feel like they can't go and get help because they don't know exactly what they're feeling. Like they can't put an identifier on what they're feeling, so they feel that it's difficult to to find the help because they're like, well, I don't know what I necessarily need help with.
That's
but
right.
that MiraVista is offering, basically the ear to listen and, help them figure out what it is and how to best approach it. I think that's an important point, that you don't have to necessarily be like, well, this is what I have wrong, so I'm going to come to you to get help with that.
Right. No, that's a great point, Chris. Excellent point, because many times I'll get calls at MiraVista from members of the community who may think they're ready for inpatient level of care because how they're feeling. But then once you talk with them and listen, you learn really what they would benefit from would be perhaps outpatient mental health therapy, or access to a psychiatrist and a prescriber. They may not need inpatient at all. And so because of, and you asked the question earlier, Chris, about collaborations and if we work together with other organizations, that's where the benefit of having those connections and collaborations comes into play, because we can say to that individual who's called, right now it doesn't feel like we're the right place, but here's all the other places that are. And do I have permission to share your contact information, or would you prefer that I give you, contact information through email? And they'll say, oh, I'm fine with you sharing my information, or no, yes, if you would please email me that information. So MiraVista at times is going to be the right course of care. And in those situations where we're not, we'll make sure they're directed to what is.
Of course. And if one of the listeners right now was looking to get help for either themselves or someone they love, what would be the best way to get in contact?
So I would say first would be our website. There is an inquiry form, which actually goes directly to my email, which is monitored, I don't want to say 24 hours a day, but it is absolutely monitored 7 days a week. So they can go on our website, and it's a short form right off our homepage, which is Find Help. So they'll click on that. They'll answer a few very short questions, and then that gets emailed directly to me. Or they can call. They can call me directly. I'm happy to share my phone number, which is 413-264-3042. So the MiraVista website is MiraVista.bhc.care. So MiraVista.bhc.care. Thank you for that.
Okay, of course.
Was there anything else that you'd like to add? Maybe something we didn't touch on that you feel is important?
I think first and foremost, I want to thank you both for the opportunity. Any opportunity for MiraVista, for me to go out into the community to talk about mental health is just so welcomed and appreciated. So thank you for the opportunity to come on. Of course. And also for people to understand that, and we talked about it, Tyler, just a little bit ago, and that's that asking for help is absolutely a sign of strength. It's not a sign of weakness. It's actually a great example of advocating for yourself. And that takes a strong person. That takes someone who's ready to live their best life and to get the help that they need. So encourage the loved ones in your life who may be struggling to know that they don't have to go through this alone. There's entities like MiraVista out there who can help them.
Of course.
All right. Well, thank you very much for taking the time. I think that this was a great and very enlightening discussion. And of course, as we've mentioned before, this is a discussion that should be ongoing. So we would love to have you back sometime to talk some more.
Sounds good.
Yes,
You don't have to ask me twice, Chris. Absolutely.
Yes.
Thank you both.
Yes, thank you again. We appreciate it.
Thank you.
And that's all for this week's episode of So That Reminds Me.
Thanks for listening, and we'll have another episode for you next week.
Thanks for listening to So That Reminds Me, produced by Western Massachusetts news source Reminder Publishing. Don't forget to subscribe to the podcast, find the latest news at thereminder.com, and follow Reminder Publishing on Instagram at Reminder Publishing, on X at The Reminder MA, and on Facebook. Reminder Publishing, we are hometown news.